Yes, so listening to the Midday News here on Joy 99.7 FM. And this afternoon, one more person is suspected to have died from the deadly Marburg virus, with at least 40 others quarantined in the Savannah region. The deceased is said to be a relative of one of the two persons who had died from the virus in June. The two people who died days apart after reporting to the hospital with hemorrhagic fever. Health authorities say the deceased showed symptoms of the Marburg virus days after the stipulated incubation period. Here's the Director General of the Ghana Health Service, Dr. Patrick Kumabwaji.
Unfortunately, one close contact reported symptoms after the maximum incubation period. That was after the 21 days, reported some symptoms and died on the 21st of July 2022. This, for the sake of the family, these are very, very close relatives or members of the deceased, where under normal circumstances they are higher risk. But what is interesting here is that it came after the 21 days quarantine. So we've taken samples and following up with them. We have identified 40 additional contacts within the Savannah region where the incident occurred. 11 of them are health workers, and 11 out of the 40 are health workers, and the rest are other new members, including patients.
Well, he also announced the rollout of a comprehensive public health measure, with all districts now on the alert as part of broader nationwide containment measures. But as this goes on, there are raging concerns about the possible risk posed by a colony of bats currently at a 37 military hospital. Virologist with the West Africa Center for Cell Biology of Infectious Pathogens, WACBIP, Dr. Yao-Bediakon, wants a biological investigation to ascertain the real risk posed by the birds.
On the surface, it's unlikely that those bats pose a threat. However, given what is, the reports of Marburg and the linkages that we know between some of these viruses and animals like bats, it may be useful to at least have some surveillance done of the colony just to give ourselves the extra layer of assurance that there is nothing circulating in that colony. So I would assume that there is probably some ongoing surveillance that happens in animal populations like the 37 military hospital bat population. It would probably be a good idea to at least have some surveillance going so that if anything emerges, it can be identified quickly and dealt with.
That's Dr. Yao-Bediakon. Well, we'll stay a while longer on the health front because the monkeypox virus is now spreading through communities in Ghana. At least 34 new cases have been recorded since the outbreak last month, with more than half of those cases detected in the capital, Accra. There's been no death so far, thankfully, but the World Health Organization has elevated the seriousness of the disease as many countries struggle to contain it. Let's hear once again from Dr. Patrick Kumabwaji.
Ghana has so far recorded about 34 cases. The last confirmed case was on the 15th of July. The first 30 we had about 20 of them from Greater Accra. We are working with the Veterinary Services Department to conduct assessment in affected communities to look for what are the possible causes so that we can identify possible contacts and those at risk.
That's Dr. Patrick Kumabwaji. Well, for men who sleep with women and then also with multiple sexual partners, your chance of contracting the disease is even higher. I'm told men who sleep with men, actually. Here's the WHO Director General, Ghebreyesus.
Although I'm declaring a public health emergency of international concern, for the moment, this is an outbreak that's concentrated among men who have sex with men, especially those with multiple sexual partners. That means that this is an outbreak that can be stopped with the right strategies in the right groups.
Well, you can't be sleeping with other men as a man. And that's WHO Director General Ghebreyesus there with that warning. Now, a combination